occur in digits 2 through 5. It is a hinge joint. It happens on the sagittal plane, which is the medial lateral axis. The patient is going to be seated with her forearm resting in mid-position or prone with her fingers in anatomical position. To stabilize this, I will be using my hand to stabilize the middle phalanx. I'll be working from the second digit. The goniometric axis I am going to have over the dorsal surface of the second digit that's being measured here. The stationary arm of the goniometer is going to be parallel to the longitudinal axis of the middle phalanx. The movable arm is going to be parallel to the distal phalanx. The end position is going to be flexed. So Erika, I want you to flex your finger there. Okay, and what I'm going to be doing, I'm going to follow through with the movable arm of the goniometer, and it reads, it's about 60 degrees, 59 degrees, seated with her forearm in resting position on the table. The wrist is going to be neutral this time, and the fingers are going to be relaxed, okay? So then I'm going to stabilize the middle phalanx, and I'm going to grasp the distal phalanx to move the hand anterior position, okay? So I'm going to move it until the motion stops, the limit of motion. And I'm going to place my goniometer on I'm going to place my goniometer hand over parallel of the middle phalanx and my movable arm over the distal phalanx. So I'm going to push. Okay, and I can get it to 80 degrees. The start position, the patient is seated with the forearm resting in mid-position or prone with the fingers in anatomical position. Stabilization, so I'm going to stabilize the middle phalanx. So my goniometric axis is going to be on the palmar surface this time of the distal interpharyngeal joint being measured. So the stationary arm is going to be parallel to the longitudinal axis of the middle phalanx, like that, and the movable arm is going to be over the distal phalanx. So now I'm going to ask you to extend your finger up as much as you can, okay? And that's actually it's hyperextended. It's 15 degrees. Our forearm is going to be in resting position on the table. The wrist is going to be neutral. The fingers are going to be relaxed. I'm going to stabilize the middle phalanx again, and I'm going to place the goniometer underneath on the palmar side of the hand over the middle phalanx, the stationary arm, and the movable arm is going to be over the distal phalanx again. This time, I am going to push you to your limit, and then I'm going to measure it, okay? Pushing your, oh my gosh, hyperextending. Okay, and that is, whoa, that is 50 degrees.
The carpal metacarpal joint of the thumb is located between the first metacarpal and the trapezium bone. The joint is a saddle joint, and the motion of flexion occurs in the oblique frontal plane around the oblique sagittal axis. The patient is sitting, their elbow is flexed with their forearm in mid-position and resting on a table. The wrist is in neutral, their fingers are relaxed, and the thumb is in anatomical position, like so. I will be stabilizing the trapezium, the forearm, and the wrist. My goniometer axis is placed over the carpal metacarpal joint. The stationary arm is parallel to the longitudinal axis of the radius, and the movable arm is parallel to the longitudinal axis of the metacarpal. So we're starting at about 30 degrees. At this point, the therapist needs to make note of the goniometer position. Although the arms are not aligned at 0, the degrees of the position is reported as a 0 start position. So like I said, we're starting at about 30. With my distal hand, I will grasp the first metacarpal and apply slight traction to and move the first metacarpal in an ulnar direction to the limit of motion and read the goniometer. So she went from about 30 to 10, so that's 20 degrees. The number of degrees that the metacarpal moved away from the zero start position is recorded. The patient is again sitting, their elbow is flexed, and their forearm is in mid-position resting on a table. The wrist is in slight ulnar deviation and their fingers are relaxed. The thumb maintains contact with the metacarpal and proximal phalanx of the index finger. I will again be stabilizing at the forearm and the wrist. My goniometric placement is the same as with PRM, which the goniometer axis is at the CM joint, the stationary arm is with the radius, and the movable arm is parallel with the first metacarpal. So we're starting at 30, and then I will ask my patient to flex their thumb across the palm to the limit of motion and follow this with my movable arm. So she went from 30 to 15. So it's a 15-degree motion.
The thumb carpal metacarpal joint. The bone is located between the thumb and the trapezium. Carpal metacarpal is a sagittal joint. The axis is an oblique sagittal and the plane is oblique frontal. The patient is sitting, elbows flexed with the forearm in mid-position and resting on a table. The wrist is in slight ulnar deviation. Fingers assume the anatomical position. The thumb maintains contact with the metacarpal and proximal phalanx of the index finger. Stabilize the client's wrist. And it's important to note when doing this measurement that the initial goniometer reading will not always be at 0 degrees, and it's important to notate that. So currently the reading is at 5 degrees. I'm going to ask the patient to extend their thumb to the ceiling. And that's 15 degrees. And then I'm going to passively extend it further. And that comes to a reading of that 5 degrees, and that would be normal range of motion at 20 degrees.